Your city, your stories. Celebrating the people and places that make Houston shine. It's Great Day Houston.
It is Medical Monday, and we're starting with a medical issue that will stop you in your tracks. For our first guest, that meant being sidelined and not able to do what she loves. After running 35 marathons, she started having severe knee pain. Doctors recommended a fix, but they also said her running days would cross the finish line for good. Especially with tough decisions like that, it's always a good idea to get another opinion. After doing some research, Caryn Honig found a doctor in another state, but it was worth the trip. That's because Dr. Richard Berger does minimally invasive hip and knee replacement surgery, which means less trauma to the body. Dr. Berger with Midwest Orthopedics at Rush joins us to explain how his procedure got Caryn back on track and on the run again. Good morning, Dr. Berger.
Morning. Thank you for having me.
Absolutely. But before we get to you, got to go to Caryn because you said, go Cougs, you are
a professor at the University of Houston. This is my 21st year there.
Oh,
so I'm pretty proud
right.
of the Cougars.
Yeah, absolutely. All right, Dr. Berger, when it comes to medicine, I think the largest growth we see right now is in orthopedics. That's for a lot of reasons. We have an aging population, a rise in osteoarthritis, et cetera, but also a rise in the investments in technology that can address these things. Let's go back to your early inspiration for getting into orthopedics. Your father crafted animated displays.
He did actually. He actually grew up in New York City, and he actually made the Macy's display windows. This was before computers, and these were stepper motors and gears, and he would make that in our basement. And I would go down and watch him, and it really got me fascinated with human motion and how to make things work, which took me to MIT, which took me to medical school, and now I do hip and knee replacement and let people get back to their lives.
Yeah, and of course, the thing that we always want is if we can do something with less trauma to the body, make it effective, and restore mobility and life. The issue with a lot of this is for some people who do nothing, when you get sedentary, that leads to so many other wrong things.
It really does. Unfortunately, your body's a system. So when one thing breaks down, the whole body breaks down. You start getting problems with other joints. You start getting weak. Your muscles actually start to atrophy. So it's better to take care of these things early and not let them continue to get worse and worse. And that's what Caryn did, which is why she's able to get back running.
Yeah, and she was able to do that because you perfected a minimally invasive joint replacement technique. Take us behind how that happened.
I did actually. We developed this about 20 years ago or so. Patients were just having a hard time with recovery. They were having a lot of pain, a lot of swelling, a very slow recovery. So I spent a long time and developed minimally invasive hip and knee replacement. That's doing hip and knee replacement without cutting the muscles, ligaments, or tendons. So there's less pain, less swelling, a much quicker recovery, but more important, a more full recovery, because it gets your knee or your hip back to how it was before you had arthritis, letting you get back to all activities, whether it's golf or tennis or skiing or running a Boston Marathon.
Yeah, right.
And I tell my patients to get back and do everything.
Yeah, in fact, one of your patients was former President George W. Bush. He was an active mountain biker and a golfer. And in 2014, both knees needed surgery. So you took care of that as well. But you take care of people from all walks of life. Caryn, you started running when?
I started running in college. I was actually a tennis player on a scholarship, and just to find a different way to relieve stress, I started running and swimming, and so my first marathon was actually in 1985.
Wow. All right, for a lot of runners, they'll say not if, but when something starts happening. When did you first start noticing some changes in your knees?
It's actually about, I was doing during COVID, it was actually my 40th marathon. I did the virtual Boston.
Can I just say, like, I'm looking at you because I'm like, I can't get through the start of a marathon. I cannot. The first few feet, I'm like, I'm done. Is this a javelin? I was supposed to be in the javelin. I'm not supposed to be in the marathon, but okay, your 40th marathon.
Yeah, it was the virtual Boston Marathon, and I wore a knee brace, and I was limping, and I finished it, and that was about it. I kept running until I finally actually couldn't run. I collapsed.
Did you realize what it possibly was?
I did, but you go into denial. You're like, this is not happening to me. I don't have bad knees. And I started going around the country interviewing doctors, and they all did the gel shots.
Yeah,
and
the temporary things.
yes,
Yeah.
and physical therapy. And
Dr. Berger, for a lot of us, that's what we'll do. We'll either compensate and kind of walk more on one knee or stay put, or go for those other things, those stopgap measures. But by the time we get to osteoarthritis or it's worn down that much, it's nothing's going to fix it but fixing it, right?
Yeah, unfortunately, those things help to the beginning, some anti-inflammatories, some injections. They get you through the early part of arthritis and get you back doing all the things you want. But unfortunately, those things start to not work so well as you get more and more arthritis, which happens with time, unfortunately.
Yeah, and let me go back to something that she said. She started doing her research. And I think so many of us just take our first opinion and walk away with that. And she knew that she still wanted to run. She still wanted to do things. And so she did her research. The importance of a second, third, or even whatever opinion.
Mm-hmm. Yeah, so continue to find people who are pioneers in the field. I do minimally invasive hip and knee replacement. I see patients from all over the country, all over the world that come and see me for a second, fourth, or fifth opinion. And we do a lot of this on computer now. So we see patients on the computer via telemed before and after surgery. So it limits the time and the expense and the hassle of coming to Chicago. You still have to come to Chicago to get the surgery, but it makes it so much easier. And again, that's the whole point of making this easier with the surgery, with the telemedicine, all of these things.
Yeah, I still have to come to Chicago. I'll just call up Oprah and say, girl, can I stay with you? We're all good. But we talk about getting those different opinions. Not all doctors are the same. I think that's where a lot of us as patients, we orthopedics should be just orthopedics, right? And that's one of the things that you knew that as a clinician yourself,
right,
that there's probably someone out there and you were going to find it.
Absolutely. And when I went to Dr. Berger and we walked through it, he looked at my knee and did all the x-rays and he said, I can get you running again. He said a partial knee replacement. He even pinky promised me. We have a picture of the pinky promise, and sure enough, I am running marathons.
Yeah, and Dr. Berger, you knew what was important to her and how to get her there. But to show the detail that you have, you also created gender-specific knee implants.
I did actually. These are most surgeries for knee replacements are actually done in women. About 2/3 are done in women. I developed a special implant that's designed for women, has a different contour, a different shape, and it actually works better in women, where we're putting most of these knee replacements in.
All right, so you have a program called BEST. Explain to people what that is.
So BEST stands for Berger Elective Surgery and Telemedicine. And basically it's a telehealth so that we merge all of what we do with telehealth. So you can, quote, see us on the computer and come for initial consultation on the computer. Makes it easier to do, opens up for everyone all over the country, in fact, all over the world. And then if we think that you're the right person to have this surgery and you want to have the surgery, we'll plan surgery. You'll come in, meet me the day before surgery. We'll go over some more things. You'll have the surgery, spend a day or two in Chicago, fly back home wherever you are, Houston or any other part of the world. And then we'll do all the follow-up on computer. So again, we're trying to make this as easy as we can from the surgery to everything around the surgery.
Yeah. What about recovery time?
So recovery time is really fast. With minimally invasive surgery, the recovery time changed from a week in the hospital to a couple of hours. So you don't even stay in the hospital. You actually just go home. If you're not from Chicago, you'll go to a friend or a hotel for a night or two and then fly back home. And most of my patients are back to work, back to driving in a week or so. Just took care of a commentator from sports who wanted to get back quickly, told everyone they were having a vacation in Disney, came, had a replacement, and got back to work and never told anyone, and no one ever knew.
Wow. All right, Dr. Berger, thank you very much. We'll give people details on how to get in touch with you in just a second, but I'm going to finish off now with Caryn. You'll be making history. You'll be the first known female to compete in the Boston Marathon after a knee replacement.
We think so. Yeah, at least I'm the first one to talk about it.
Right?
Talk about it and claim it.
Yeah,
right?
and you're also running for a cause.
I am running for suicide prevention and awareness. And this is after my grandfather and father both died by suicide. And so I am running, every mile for someone, a loved one who has died by suicide, and each name will be written on my arm.
Wow.
I have about 20 names so far. And so
Founded Poppy's 5K run in honor of your grandfather?
Correct.
Yeah, that's amazing. And you got me my shirt. I have my tag number and the whole bit. So I will not be running, but I'll be the one on the sidelines clapping for you. It's like, do you need water? Here I am. But anyway, thank you for what you do. Dr. Berger, thank you, because I know so many people who are dealing with this. We're just coming in that age range where, you know, body parts we're outliving them, they're kind of wearing out. But thank you very much for sharing this new technique.
Thank you for having me.
All right, Dr. Richard Berger is offering the Berger Elective Surgical and Telemedicine, or BEST program, for those who travel to see him. For appointments with Dr. Berger or to learn about BEST, call this number. It's 312-432-2557. Again, that number is 312-432-2557, or to visit outpatienthipandknee.com. outpatienthipandknee.com.